Gross negligence is part of a class of lawsuits that we call torts. Torts include things such as negligence, gross negligence, or perhaps even intentional torts. And those are just different degrees of culpability. A gross negligence case is when one fails to exercise even slight diligence. It's what the law says a careless man, an inattentive careless man, would do. That's difficult sometimes for a jury to reconcile. And it's especially difficult when the concept of gross negligence is applied to a medical malpractice case. We don't have to prove that doctors and hospitals intended to cause harm. What we have to prove is that the violation of the standard of care that we contend occurred, which is supported by other experts who testify under oath that they believe that negligence occurred, was a substantial or gross deviation from the standard of care, meaning it's not very close. It's sort of strongly, the evidence is strongly in favor of the patient. We not only have to prove that degree of culpability in some cases involving emergency medical care, but we also have to prove that by what's called clear and convincing evidence. Clear and convincing evidence is a burden of proof that lies between beyond a reasonable doubt, which is what we have in criminal cases because we're taking away people's freedom or perhaps even their life, and a preponderance of the evidence, which is the burden of proof that applies to an ordinary negligence case.